Okay, the next thing I want to tell you about is the vital sign worksheet. The vital sign worksheet is a place for you to document symptoms and participation recovery plan, and so that you can identify trends. Let me take you to the vital sign worksheet now. Okay, this is based on date. It's anchored on a day when you do a PHQ-9, and I would advise that you do the PHQ-9 every time you have contact with your clients. And if you remember, I'll pull up the PHQ-9 too. We talked about that and how you are going to be totaling up the columns. There's only going to be one selection per item, one number, and then we're going to total up each column, and then we total those things up so that those three values turn into our total score. Okay, that total score is what you want to transfer to the vital sign worksheet. We're basically taking a temperature reading sort of these depressive symptoms, and so anything over, say, 10 is indication that depression is becoming moderate to severe. So the way it is that you put the date here where it says baseline. You put in the score. So if the score was 9, you would write 9 right here. And then you also fill in the bullet. So if it was 9, you would fill in this bullet right here. Okay? On that same date, we're not going to be talking about the wellness plan or therapy or medication today, but in the future we will. On that same date, you would follow down and you would fill in these bullets too. So if they were participating regularly or sometimes or not at all in their wellness plan, you would fill in that bullet. If they were attending therapy, if they're attending every session or some of their sessions or none of their sessions, you would fill in that bullet for that date. And then finally, if they were on medication, are they taking the medications as recommended? Yes or no? So the important thing is that this column, this whole column, represents the date that you have up here at the top. So you don't want to put the date one day here and then information in the next month on the same column. That would be confusing. The purpose of this worksheet is to anchor this date and to identify not only the symptoms, the degree of symptoms on that day, but their participation in their therapy. If they're doing psychotherapy, if they're doing medication therapy, or if they're just sort of waiting and seeing and they're practicing a wellness plan, whatever, it's telling you, are they doing the plan? And so what this does is over time, then you see them next month and you put in the date for next month in the next column, and you put the score for their PHQ-9. You anchor that score into one of these bullets, wherever it is. And you can see that the last 3 rows are shaded. And the reason that they're shaded is it's like, whoa, it's to alert you. Okay, we're entering the zone where it's not so good. I need to really tune in and say, are they not taking their medications? Have they not been going to their therapies? It's for you to go. The bells should start ringing if you start to enter bullets in this area that's shaded. So what this will help you with is over time, you can not only see it yourself, wow, it's getting better. Look, this is so great. Or it's not, things aren't going so well. What's going on? Let's start over. Let's review the plan. It also gives you something really tangible that you can give to the provider. It's quick, it's easy, it's visual, it's good for you. You can show it to the client and say, look, when you were going to all your sessions every time and you were taking your medications, look where your score was. And then you kind of trailed off, or you had those problems with transportation. Remember, it is associated. So anything we can do to make sure that we can strengthen your environment and get you where you need to go, you're going to see a better result here. So it makes them participate, it makes them involved, it makes them feel like they have control over their score and their symptoms, and they're going to feel better, and that they're not so vulnerable, and that they can do something, and they're participating now, and that's our goal. And then also, it's something that you can give to the provider, and quickly, in a blink of an eye, they can look at it and sort of see the picture. Their time is very limited. You have more time, and you can provide something very useful for them to make a decision in their short period of time. So that's the vital sign worksheet, and I just love it. And I hope you love it, and I hope it helps you. Okay. All right, so this helps us to identify trends. And that gives us a nice list here, what we've talked about so far. Our script for calling in the beginning, and our etiquette, collecting information on every single phone call. We want to take notes, and implementing the PHQ-9 and focusing in on the last 2 weeks. We talked about the getting to know you worksheet so that we can provide better care. We talked about the vital sign worksheet. We've talked in the past about the books that are available on the CPIC website. Beating Depression, The Journey to Hope. Excellent book, which I recommend for not only your clients, but for you. And then also, Are You Feeling Tired, Sad, Angry, Irritable, Hopeless? This is in both English and Spanish, and also downloadable on the CPIC website. So that summarizes webinar number 2, and I look forward to seeing you next week.